video will show you how to wrap gauze sponges for the HOSA prep of the operative site exercise. This is the same general technique that you will find used in wrapping instruments for autoclaving in your clinic. Now, the materials that you will need are a piece of instrument wrap. This is disposable wrap. It's sort of a cross between fabric and paper. The items to be wrapped, in this case, it is a stack of 8 to 10 4x4 gauze sponges, a in-pack sterility indicator. This strip goes inside the pack and will tell us by its change in color that the pack has reached the right internal temperature to be sterile. And we have a piece of indicator tape with which we will close the pack. The pale stripes on here will turn dark brown or black in the autoclave so that we have an indicator on the outside of the pack that the pack was properly autoclaved. Typically on this tape we will write the date. So I'll write today's date on here and my initials and what the pack is, so that it will be easy for the user to take out the correct pack. So I have my piece of tape prepared with my name, initials, and date, and the name of the pack, and we will go ahead now and wrap our gauze. So what we want to do is set the gauze on the wrap at an angle, and we always wrap on an angle. So rather than setting your gauze so that it looks like a square within a square, you should turn it 45 degrees so that it appears that you have a diamond within the square. At this point then we will start to wrap. Start with the flap closest to you, bring it up over the gauze, and then fold back a small triangle back towards your body. This will form a flap that will let us grasp this without touching the sterile gauze inside when we unwrap the pack. Next, go to one side adjacent to the one you just did. Again, snugly across the gauze, and turn a triangle back. Then we turn the next side, again snugly across the gauze, and turn a triangle back. The last flap, I usually turn to go away from me just out of habit, needs to come snugly up across the gauze. It will now tuck underneath the two side flaps that you created and end with a tiny triangular tail sticking out. So your pack is now self-contained. The tape is mainly just for identification. So we place our tape across, and now we have a neat square gauze pack ready to go so that we can do our prep of the operative site after it has been autoclaved.